Good morning, good afternoon, good evening, depending on where you're joining us from. I'm Megan Phillips of the Train with Trust Project, here with Jody Ambrose, co-founder of the Train with Trust Project. And we are happily joined by Dr. Sue Dyson, world famous orthopedist, equine orthopedist and researcher. Here at the Train with Trust Project, we are dedicated to making animal behavior education accessible and to promoting the use of evidence-based training methods. Today, we're going to be talking about Canter Dysfunction, which is one of the 24 behaviors of the ridden horse in pain, one of the 24 behaviors of the ridden horse pain ethogram developed by Dr. Sue Dyson and her colleagues. And at Train with Trust, when it comes to training and behavior, we're always encouraging our clients to be observant and know what is normal for your horse or for their horse, so that if something comes up, folks can be aware of any changes early and get a head start on addressing that problem right away. So this discussion of Canter dysfunction and understanding all of these details, we're hoping will be really helpful for everyone to help out in that regard. So with that, I'm going to turn the discussion over to Jody.
Hi there. So as Megan said, the Canter dysfunction is number 18 of the 24 behaviors. And when we were really learning about all these things, we found that number 18 was the most complex to understand because there's a lot of different variables. And so I am really excited to talk to you, Dr. Dyson, about this because I feel like there's just a lot to get into about this to understand it and break it down. And also as a trainer, I find that there's often a lot of confusion about problems in the canter, whether they are training issues, whether it has to do with the capacity of the horse, whether it's strength and fitness or ability, or whether it is pain related. And when you go to investigate these things, you ask the trainer, you ask the vet, you go by what you feel. But I would like to have a little bit more of a concrete idea on how to discriminate where the problems are coming from and what causes different issues in the canter. So can you just start us out by briefly talking about the biomechanics of the canter and what a normal canter looks like?
Yes, certainly. I think canter is very different from trot and walk because, for example, in trot, it is a 2-beat gait. So the horse is landing on diagonal pairs. So it's always sharing load between one hind limb and the opposite forelimb. In very big moving dressage horses, which have advanced diagonal placement, they may place one hind limb slightly in advance of the opposite forelimb, but that is pretty transient. In canter, we have a 3-beat gait. And this 3-beat gait means that the horse is initiating canter by the placement of the outside hind limb if we're going around an arena. So if we're going on the right rein, canter is going to be initiated by the left hind limb being planted to the ground. And that left hind limb is carrying all the load of the horse. And when it lands on that limb, forces are going to be generated up the entire limb and up to the pelvic region. And the hind limb and the pelvis are integrally related via the sacroiliac joint. And this is putting a great deal of asymmetrical loads on the pelvis. They then have the inside hind limb and the outside forelimb placed to the ground together. And finally, the leading forelimb is placed to the ground. And then in a correct canter, we have a period of suspension with all 4 limbs off the ground. So that's what the correct canter should be. Now, we also have to remember that force equals mass, that's the horse's body weight, times acceleration. Canter is faster than trot, so the forces of acceleration are greater in canter than at trot. So this is another issue that we have to contend with. We then have to think about the placement, not only of that leading hind limb, but also the forelimbs. We see that because the forces are greater, that's going to impact both on the hind limbs and on the forelimbs, which is going to potentially influence the quality of the canter if there's pain. And then one additional thing is that there is more movement of the base of the neck in canter than there is in trot and walk. So if the horse has any degree of neck discomfort, this is also potentially going to influence the canter. Now here we see a nice canter, a nice uphill canter. The hind limbs are sufficiently underneath the body. The horse has got an uphill frame. Its nose is slightly in front of the vertical. The rider's hands are not in any way restricting. To me, that's a lovely picture. But it's a picture that we so often don't see, because so often horses are not in proper balance. And the incidence of the horses actually showing a suspension phase is disappointingly small. When I was looking for a photograph of suspension, I went through 60 consecutive horses doing dressage tests, and I found one horse showing a suspension phase. And my camera takes multiple frames very, very quickly. So if there's a suspension phase, it will capture it. But in 60 horses, I found one, which means to me that many of these horses are not cantering correctly. Now, whether or not that's a training problem or whether it's a pain-related problem, we need to discuss further. But we should be aiming for this 3-beat canter, the trailing outside hind limb, then the inside hind limb and the outside forelimb together, and then the inside forelimb, and then a period of suspension, with the horse moving powerfully, propelling itself from its hind limbs, so that the forehand is being lifted somewhat, as we see in this beautiful picture here.
I think a common misconception is that the lack of a suspension phase is something that is just inherent in a particular horse. Like this horse doesn't have a clear canter or a 3-beat canter. And can you talk a little bit about what causes a canter to be not have a suspension phase, other than just that horse's canter is like that?
Well, I think we have to recognize that different horses have different levels of athleticism. So a child's pony is much less likely to show a period of suspension compared with a prospective upper level dressage horse, even if it's just 4 years of age. But I think that the way in which horses are ridden is very, very influential. So if I take those 60 horses that were observed during warm up for dressage and during their dressage tests, if I went and watched those horses warm up for show jumping, I would see a very different situation, because the riders would by and large ride the horses forward more. They would ask for a stronger canter. They would probably allow more with their hand. They would be less worried about the frame in which the horse was working. And as a consequence, they would have a canter with more jump. So the canter would be better. So it's very much, I think, a reflection of how the horse is being ridden, although it could be a reflection of the horse experiencing some discomfort.
Right. So in other words, you sort of grade on a sliding scale that some horses are going to have the capacity to have more suspension than others, but you have a spectrum of the amount of suspension in a particular horse that you might see more if the horse is ridden well and sound versus if not.
Absolutely. I mean, my philosophy is that any horse that is appropriately trained should be able to canter correctly.
Got it. So other than being able to see 3 clear beats and a suspension phase, what are the other things you look for in a healthy, normal horse when they're cantering?
Well, that you've got this, obviously it's going to depend a little bit on the stage of training, but we saw that horse, which was a 6-year-old horse, with this uphill frame, which is correct. we see many horses which are completely different. They're down in front, so they're on their forehand, and they're croup high because they are finding it difficult to adequately engage the hind limbs and push sufficiently from behind. And assuming that the horse has had appropriate training from the early stages of ridden exercise, that should be progressively improving. If it's not progressively improving from an early age, then that generally means that there is an underlying problem. I hear repeatedly people will say, well, I bought the horse as a big gangly 4-year-old and he found it difficult to canter. He was on the forehand all the time and he's slow to mature and he's 7 now and he still doesn't canter very well. And I think to myself, well, if he's had appropriate training for 3 years, he should have developed sufficient strength. He should be able to canter now. We're making excuses for the horse. We're not thinking, what is the reason why this horse cannot canter now? So the horse can adapt by being on the forehand. It can adapt by being crooked. So instead of the hind limbs following the tracks of the forelimbs, the hind limbs deviate in on an inner track. The horse may find it difficult to maintain the canter, so it may break spontaneously from canter to trot, or the transition from trot to canter may be difficult. Or once canter is established, the horse, particularly going around the short sides of an arena, may become disunited or cross canter. So it's changing the leading leg behind without changing in front. And then there's a horse that becomes very tense and is kind of boiling up because it's uncomfortable probably. Or there's a horse that really doesn't want to go in canter. It's unwilling. And that horse may break spontaneously, or it may just need to be kicked repeatedly in order to maintain the canter. And that's not normal. So those are the principal problems that we see with the horse, but it also has an impact on the rider as well. So as a rider, in a normal canter, you should feel that your pelvis is being rocked backwards and forwards with no rotatory movement. When a horse doesn't canter correctly, it often adapts through its entire body. So it effectively stiffens the back. So you as a rider will get more of a jarring impulse through your back. If the horse is very much on the forehand, you may feel that your upper body is being rotated backwards and back to the vertical position and backwards, because that's just the way the horse is throwing you. Then some horses create this kind of juddery feeling. So if you watch suitcases go along a conveyor belt at the airport, you will see that they bang along and you sometimes get this kind of juddery feeling. And then with some horrible horses, you actually feel that your entire pelvis is being rotated. So I call that the washing machine canter, because it just is so ghastly and uncomfortable for you as a rider. So the normal horse should feel comfortable in canter. You should feel that you can sit on it. Now, the amount of impulse that it generates through its back is going to vary depending upon how big the canter is. So some horses are going to be easier to sit to than others, but it should be comfortable to you as a rider, assuming you haven't got any pre-existing injuries.
Yeah, it's interesting. You talked about how rare it is to be able to photograph a horse with a good canter. I used to teach dressage on a simulator, which had a really realistic feeling, balanced, good canter. And it was interesting how few people actually had the experience of being able to work on their position in a good canter rhythm. And I was able, because it was stationary, I was able to have people hold their hands on a point in the distance and hold them still, which had the effect of keeping their shoulders perfectly still because their hands would go up and down if they moved their shoulders. And when they stabilized their upper body and felt their pelvis move, rock back and forth with the canter, was a new sensation to a lot of people, because especially at the lower levels, beginning riders, they ride horses that have these washing machine canters, or, you know, the really rocking back and forth or jarring canters. And it's sort of a closed loop of people that don't learn how to ride with a correct canter seat because the canter isn't correct, and then they can't correct the canter because they're not riding correctly. So yeah, it's important. That's what's so exciting about teaching people about what to look for in the canter, because these things need to be addressed for people to really learn how to progress themselves as riders. Speaking of it being an asymmetrical gait, when you are evaluating a canter, how do you determine where to start? Because you're not in a trot, you can clearly see which side the problem's on, whether it's a front leg or back leg usually is fairly clear. So in the canter, it seems a little bit more muddy to determine where to start. So as a vet, what do you begin with?
Well, I have to say I've come from this as a rider, really, because I have felt things and then I've learned to observe better, because nobody ever taught me about canter. This is something I've developed for myself, really.
It's interesting.
So to me, if the horse has got a stiff-legged hind limb gait in the canter, so it doesn't flex the hocks, doesn't flex the lumbosacral joint, the hind limbs don't go far enough under the trunk, that tells me it's probably a hind limb problem primarily. If the horse is very much on the forehand, that also tells me it's probably a hind limb problem. The horses that change legs behind, becoming disunited, generally have hind limb problems. Although in saying that, a young horse which lacks musculoskeletal strength and coordination will find it difficult to maintain true canter around the short side of an arena when it's beginning. And I think those horses are better off being taught to carry the weight of a rider in a straight line initially, rather than in circles. Now, if I look at the canter and I think the horse looks as though it's not really separating the hind limbs. So instead of the hind limbs being placed apart, they're placed close together in terms of actual space between them is smaller, and the time for which a single limb is bearing weight is short. So in its extreme form, what we call bunny hopping, that also is a sign that it is probably a primary hind limb problem. So what's happening with that is that the horse doesn't like loading that trailing hind limb, the limb that is bearing all the weight initially. So it puts down the other leg as close to it as possible, as quickly as possible, in order to share load between those two limbs. So it's removing the extreme load it was taking on that initial leg that initiated the canter. Then you have horses who have either forelimb pain or neck pain, and they don't want to lift the feet very far off the ground, their front feet very far off the ground. And you see what I call an earthbound canter. The front feet remain close to the ground, so that reduces the force which is going to be generated through the forelimbs as the horse lands, which will also reduce the forces at the bottom base of the horse's neck. And remember what I said about the up and down movement of the neck being greater in canter than in trot. So they try to fix their necks as well. So those are the principal ways that we can try to differentiate. Now, it can be difficult if you're saying, well, is it one hind limb or both hind limbs?
Mm-hmm.
And if it's one hind limb, which is it going to be?
Mm-hmm.
And that doesn't follow any really good rule, I would say. But I would always, if the rider says to me, canter to the right is easier than canter to the left, then I would think, well, thinking about this logically, canter to the left is more difficult. That's when the right hind limb is initiating the canter. And so it's overloading that right hind limb. So that would have a high index of suspicion. I would also watch the horse from behind, because in association with an abnormal canter or with low-grade hind limb lameness in trot, we may see saddle slip. And the saddle tends to slide towards the side of the more uncomfortable limb. And if the saddle slips, it slips more in canter than it does in trot. So if we observe the horse from behind and we see that the saddle is slipping to the right, then that gives us an additional clue that the right hind limb may be the problem limb, or may be the worst of two limbs, because very, very frequently we're dealing with problems involving either both hind limbs or both forelimbs, rather than just one. And sometimes we have problems behind and in front.
Right. And in the back, right? So
yes. If the horse is hugely better with you sitting out of the saddle in a 2-point position rather than sitting in a 3-point position in the saddle, that may reflect the fact that the horse has primary back pain, but it also will be influenced by the presence of lumbosacroiliac pain. And one thing which is very interesting about lumbosacroiliac pain is that some of the affected horses look pretty normal on the lunge, and they may be able to trot adequately, but in ridden canter, they are a great deal worse. And they may also have some baseline hind limb lameness. And in those horses, you take away the baseline hind limb lameness by nerve blocks. They may improve in the trot, but when you look at the canter actually deteriorates, because now another source of pain has become the primary source of pain.
Oh, that's really interesting. So you wouldn't expect that the horse would get worse with nerve blocks, but that seems like a sort of telltale sign that you could look for.
Yes. Yeah.
And that was actually one of the questions we got from someone, was about saddle slipping, and how to tell whether it's about saddle fit or something else. And it seems straightforward to me that if it's happening in one saddle versus not another saddle, that's a good way to tell that it has something to do with saddle fit. But it sounds like when you have this issue due to lameness, it would happen in pretty much any saddle. Is that?
Yeah, absolutely. So you can switch saddles, and it will happen to just the similar extent. Now, the argument always is, well, what are the different causes of saddle slip? It could be that you have a crooked rider, but we have to remember that if the saddle slips, the rider is generally taken with it, which induces crookedness in the rider. So if the saddle slips with two different riders, then it is more likely that the saddle slip is induced by the horse. Now, we do see some horses which have got very asymmetrically muscled backs, and that does have the potential to induce saddle slip, but by far the most common reason is the horse is not moving normally behind, and that is altering the way in which they're moving their backs as well.
That actually brings up a sort of related question that I had, which is that as you were just saying, a problem can be caused by a specific rider, but I've had the experience where a horse will show certain signs with one rider, and then with a more advanced rider, like the trainer gets on, and the problems go away. I guess my question is, obviously that could be a sign that it's being caused by the rider, but could this also be a sign that, or could this also be caused by a certain deftness of rider being able to mask certain problems in the canter? Because that's something I feel like I've seen.
Oh, unquestionably. I think that a more effective rider who is more in balance, who has stronger leg cues, stronger back cues, can improve the canter. And this is where I think that differentiation between a rider-related problem and an underlying horse pain-related problem comes into the ridden horse pain ethogram comes into its own, because if the quality of the canter is improved by the better rider, but the horse shows, for example, 8 out of 24 behaviors with both the normal rider and the more experienced rider, it's showing that the more experienced rider can make the horse canter better, but it's doing it despite pain. And I think horses are very tolerant. They will try, and a better rider gets on and they will try most of the time to perform better. If the horse's behaviors disappear dramatically, so it had a score of 8 out of 24 with the normal rider, and then with the better rider, the quality of the canter improves and the behaviors reduced to say 3 out of 24, that's more of an indicator that it is a rider-related problem rather than a primary horse-related problem.
And that's another area where, keeping track of those numbers as a baseline can be really helpful too, because if it is a physical problem, in my experience, it will progress and get worse with the rider, regardless of whether the rider is helping it or not. Eventually, that problem is going to break through and cause more and more of those behaviors with both riders. So, going back to the beginning, that's why we love the idea of having the ethogram as a way to observe and measure these behaviors and keep track before there's a problem. It's not just about diagnosing the pain, it's about knowing what's normal and what's getting worse or getting better. So and on the topic of progression in training, can we just sort of go over what you would look for at the different stages as being something that would maybe raise concern? So you've got a horse that say has not been backed yet, and is just struggling with canter on the lunge line, swapping leads behind or bucking, hopping. At what point do you say, okay, I need to get this horse looked at?
I'm never too concerned about what happens on the lunge in a young horse, to be honest, because I think that the lunge is a very demanding exercise. And for a big, unbalanced horse that doesn't have great musculoskeletal strength and coordination, to put it on the lunge, say on at best a 20-meter diameter circle, but frequently it's less than that, is very challenging. So I don't worry. But I would always say, if it's cross-cantering or becoming disunited on the lunge, don't worry. Get on and start riding it, and start riding it in straight lines. And some of the horses, I think, one also sees, may have a wonderful canter if they're loose in the field or if they're loose schooled in an arena. And as soon as they start having a rider on them, they lose the quality of the canter. And I think that they have to learn how to carry the weight of the rider. And once again, I would always say, teach them about canter hacking out without trying to restrain them. Hacking out alongside another horse. I know some people are anxious about going outside arenas, but I would strongly, strongly advocate for these horses that are finding it difficult within the arena, take the horse out of an arena, go to a big field, canter behind or alongside another horse. And the horses will learn that this is a pleasurable experience and learn how to move their bodies. And I think that's very important. And then, as we start to introduce the arena work, the canter to the left and the canter to the right should not feel too different. They will feel a bit different to begin with, and I don't really worry about that. But I worry if the horse doesn't improve. Or we may have the situation when the horse starts by being a little bit less easy on the right rein, and then that switches after several weeks to the left rein. That doesn't worry me. But we should still be seeing progressive improvement in the quality of the canter as the horse is getting stronger. If we start to see marked differences between the left and the right reins, or the horse is much less willing to canter on one rein than the other, those are alarm bells. Those tell me something's not right here, because the horse should be willing to canter on each rein, and it should be able to maintain the canter. If it's continually breaking on one rein compared with the other, that's not normal. That's another red flag. Something is not right here.
And the next stage after that I see a lot of people have issues is when they are moving up into more collection and particularly into the flying changes. Can you talk a little bit about, well, first of all, can you talk a little bit about the effects of cantering behind with the horse behind the vertical?
Well, I think we face an epidemic at the moment of training horses in a rather fixed outline with their heads behind the vertical, at both trot and at canter. And I personally feel that this is very detrimental to the horse's development of correct patterns of movement, because with the head in that fixed position behind the vertical, it will alter the neck posture. It will alter the engagement of muscles of the thoracic sling. Remember, the forelimbs are hung from the horse's body by muscles. There are no joints there. And it's really important that those muscles learn to function properly. And they will only do that if you've got adequate frame of the neck. And as a consequence of the head being behind the vertical, it will also mean that there is restricted movement through the back, and the horse will inevitably find it more difficult to engage properly the hind limbs. So this head being behind the vertical is going to have an overall deleterious consequence to the entire way in which the horse moves. And I strongly believe from personal experience that if horses are trained in this way, I think it makes them more susceptible to a variety of different injuries, particularly in the hind limbs. So to me, correct training is really important, which is why I showed that photograph early on of the horse with its neck up and the head slightly in front of the vertical, because that's the sort of picture I want to see with a relatively young horse in its work. So it's going uphill, it's learning to move those muscles and contract and relax those muscles of the thoracic girdle, and develop the hind limb power, develop the engine. We always have to remember that the power comes from behind, and canter is dependent upon power. I sometimes get on horses, clients' horses, who said that they've had some problems jumping. And I think, well, it's not surprising they've had some problems jumping, because the horse doesn't have an engine. If it's going to jump properly, it has to have that engine, and the engine comes from the hind limbs and the muscles of the hindquarters. And then when we come on to collection, we're asking the horse to flex the lumbosacral joint more, bring the hind limbs further underneath the trunk in order to push more, which is more biomechanically demanding for the horse. So if it has any low-grade problems that it was surviving with in the less demanding work, working in working canter, for example, as it's asked for collection, it's going to say, this is becoming uncomfortable. And then you will start to get into a vicious circle that the horse will say, I'm not going to do this. And then they start to brace their backs. And then you go in a downward spiral of decreasing quality of the canter. And when they come to do flying changes, that is technically quite difficult, but also it's having an impact on both hind limbs in terms of you're changing the leading hind limb. So each has to push off really strongly, each bearing load alone. So many horses which have had problems that they've been living with adequately before they were asked for changes, then find the changes difficult. Sometimes they only find them difficult going from, for example, left to right, but sometimes they are affected both ways, just one way more than the other.
Yeah, I always tell people that if a horse understands what you want and is physically able to do it, and you make it worthwhile for them, they will do it. So one of those pieces is missing. And so I think with the changes, I always, if someone's never taught changes before on a horse, on a horse that doesn't know changes, you've got to take one of those elements out to really be sure whether it's the horse, whether the horse understands what you're asking for. But if it's worked on another horse and it's not working on this horse and it continues not to work, and someone who has ridden lots of changes is also having trouble, it's a good way of determining that there's something that the horse is having trouble doing that is making it not worthwhile to them to try. And I think that applies both to horses as they move up in dressage from in the US from second to third level where they need to do flying changes. A lot of people get stuck. And I also see it in jumping, whereas they start to move up to higher jumps. And with the hunters, they need the automatic changes. With the jumpers, you see a lot of bucking after jumps where they need to switch leads. And so it seems like there's a lot of indications that we see that are sort of normalized.
Yes, and it's very interesting to me when you watch some of the upper level jumpers, and they will allow their horses not to change behind because they know that they're going to keep a better rhythm and the horse is going to jump better in that way. They don't make a fuss about it. Whereas somebody at a lower level may be more concerned and want to make the horse do the changes, and that makes the situation worse, both mentally and physically for the horse.
That's a really good point. I think that applies also to multiple disciplines that, and it goes back to riding behind the vertical as well. I think people are they internalize that if a horse's head is up or they're cross cantering or they're on the wrong lead, that is something that absolutely must be fixed immediately, whether they're in the show ring or whether it's during the training process. And I think that's a really good point for people to hear, is that during the training process, sometimes it's okay to let the horse do what they need to do to figure out the best way to get where you're going. And you don't have to micromanage every little piece of the training process because it's how it's going to look in the end. And sometimes the horses are smarter than we are in terms of figuring out how to arrange their bodies and figure out how to learn things, because once they learn, then you can fine tune, straighten and correct and all those things. But during that training process, it's a whole different mindset to go into it with, okay, I'm just going to let this horse be how he needs to be to figure out how to arrange himself and get done what we're trying to get done. I think that's really interesting. So we had a lot of questions that were fairly specific about individual horses. I'm going to sort of pull some things out of those questions that I think might be of interest to people in general. And then some of the more specific questions you may choose to answer on the blog later. And people can get more information about their individual horses that way. One thing that seemed to come up a lot is what part does breed, conformation, genetics play in the canter and canter dysfunction? And you sort of touched on this, that each horse has their spectrum of normal. But can you talk a little bit about some of the different limitations that some horses have?
I don't think that breed by and large has a big role to play. Although in saying that, if you're buying a thoroughbred horse off the track, then that horse will probably have been living with a number of different problems. Quite a high proportion of them have some extent of sacroiliac pain, and therefore they find canter difficult. So they're living with problems. So it's because of their history rather than because of the breed per se. And if you've got, for example, an Icelandic horse that naturally tolts, so it trots fast and has these special gaits, then they find the canter more difficult, I think. But other than that, for most breeds, I don't think breed comes into the facility to canter. I think that potentially conformation can, if the horse is inherently croup high, it's going to find it more difficult to sit behind and push properly from behind. But we have to try and differentiate between those horses who developed in that way. So from a young horse, they were always croup high and have remained croup high, versus the horse which has become croup high because it's altered its posture to accommodate pain. And those are two different scenarios which need to be addressed in two different ways. Because if they've altered their posture because of pain, we've got to address the pain if we're going to solve their problems in canter, obviously. Whereas we might have to accept that the horse who has always been croup high is never going to have potentially as good a quality canter as a horse that was better conformed.
We did have one question about someone who has a Frisian cross, and I've had the experience of having a Frisian that really struggled, of multiple Frisians actually, and crosses that struggle to canter. And I'm aware that there is some research about anaerobic threshold and certain breeds having a smaller window of aerobic capacity and building up lactic acid under more intense exercise. And that they've there's been, I read a study where they did a couple of different protocols of conditioning, and conditioning more at the trot led to better outcomes in the long run, and there was greater improvement in the canter if they actually did more training in the trot than trying to canter and having them up above that threshold where they were actually experiencing more difficulty, higher heart rate, and more lactic acid buildup in the canter. So I think, and then there's more and more instance of storage myopathy disorders in certain breeds too, which in my experience can affect the canter earlier than it affects the trot. I've had horses where the problems show up in the canter earlier. Can you talk a little bit about things like that, and maybe also about ulcers too, that I think there's a common conception that reluctance to canter, hopping in the canter, those kinds of things are frequently related to some of these other things that aren't necessarily musculoskeletal pain.
There's a lot there.
Yeah.
the Frisian. The Frisian is a complicated breed, I think, because inherently it was bred more as a driving horse than as a riding
Exactly.
horse. They are relatively inbred. They do have different collagenous structure to other horses, and therefore are more predisposed to collagenous injuries. So suspensory ligament injuries, plantar annular ligament injuries they are predisposed to. I think also because of their conformation, they tend to want to overbend, and that can result in narrowing of the airway, because when a horse is overbent, then the airway goes from being this sort of shape to this sort of shape, and it effectively you get air turbulence and a narrower space through which the air can pass. So some of these horses run out of puff because they just functionally can't get the air properly through, and the actual structure of the pharynx and larynx becomes more unstable in that situation. So you may actually get physical obstruction of the airways, which doesn't help the situation.
Right.
So the Frisian is a complex situation.
Yeah.
We have to bear in mind with any horse that if the head and neck are like this versus like this, it is going to affect airway function.
Yeah, that's a great point.
With respect to polysaccharide storage myopathy, I think that this tends to get overdiagnosed, and I think that some of those horses actually have primary hind limb problems, which could be managed if they were diagnosed. So it's an overdiagnosis by people who have not necessarily investigated other possibilities. So I would be cautious about necessarily jumping in and saying polysaccharide storage myopathy is the primary cause of a poor canter. It would have to be, to me, very much a diagnosis of exclusion of all other possible causes before I jump. With respect to gastric ulceration, well, ulcers get blamed for countless things, but I don't think there is any evidence whatsoever to indicate that Canter specifically is affected by ulcers. It's more likely that the horse is having problems with Canter because it's uncomfortable, because of it's got a musculoskeletal problem, and that's why it's developing ulcers, because it's experiencing stress, because it hurts, because it's got musculoskeletal pain. So it's more the other way around. It has recurrent ulcers because it's got musculoskeletal pain, and it's the musculoskeletal pain that is causing the problems in the Canter, and not the ulcers causing problems in Canter.
That makes sense. Was I sorry, I did ask too many things in one question, so I'm trying to remember what I asked. And you mentioned the breathing problem. So again, roaring is another cause that I hear problems in Canter attributed to a lot. Would you also rule out other problems first, or would you scope for that?
It would depend whether or not I thought that the horse was compromised in its gait. My observation is that many horses which are uncomfortable in their work make a louder respiratory noise, and they do so more in Canter than they do in trot. And if we take away their pain using nerve blocks, then that respiratory noise decreases. And we've shown that recently. We did a prospective study of 150 horses undergoing investigation for poor performance. And one of the things we recorded before nerve blocks and after nerve blocks was the respiratory noises. And we saw that there was a reduction in the respiratory noises after removal of pain. So I would always approach it from the pain perspective first. Unless I felt that the character of the noise was more characteristic of Aurora. But we also know that the airway function, as I said, is influenced by head and neck position. So you can have a horse that perhaps is getting very strong in the Canter because it's got musculoskeletal pain. The rider restricts it more, and therefore it flexes more at the pole, so the head goes behind the vertical, and the airways are restricted, and there is therefore an increased potential for abnormal movement of part of the airway. So the aryepiglottic folds may become partially displaced, for example. And we see this both in dressage horses and in show jumpers. And the problem with the airways may actually be related to the way in which the horse is being ridden, the horse being ridden very strongly, because the horse has got some primary pain elsewhere. So it's always teasing out what is the chicken and what is the egg in these situations.
Right. So let's go ahead. I'm going to pull up a few questions that we got asked about specific sort of case studies, specific horses, or maybe Megan, I don't know if you want to go through those, or if you want me to read them. You just popped up, so I'm going to see if you wanted to do something. We can't hear you. You're muted.
Yes, always good to unmute if one wants to be heard. Yes. We did have one question. I think it might be good more towards the end, as far as looking at these specific questions that were sent in. A lot of, like you said, a lot of the things that were posed to us just got answered with you guys talking about the PSSM, MIM question came up live, gaited horses, and how, how there might be different effects there.
There was one question about bucking at the beginning of exercise, I think.
Yes. Yeah, that was one that we just got in this morning.
Yeah, and I think that so the question related to is there a problem if the horse bucks in canter on the lunge, or bucks when you first do a transition to canter, but then sequentially all the transitions are super?
Mhm.
And I would say I would want to know more about what type of buck it was. So, and to me, there are bucks when the horse humps. So I call it an N-shaped buck, which can be fairly unseating, and you feel that the horse wants to get you off. Or you can have a U-shaped buck when you feel pretty safe and the horse is bucking and kicking out, perhaps.
Mhm.
Now, those bucking and kicking out can be a manifestation of sacroiliac joint region pain. And I think some of those horses have associated nerve-related pain. So some of those show jumpers that you see land, having got deep into a fence, had to make an extreme effort and then land and buck and kick out. I think those horses have a component of sacroiliac region pain. But the horse that just does a couple of bucks on the lunge through sheer joie de vivre, and the horse which is cantering when you first go into canter just does a small buck and nothing else, that wouldn't worry me unduly. Unless I felt the horse was trying to buck me off, of course.
Mhm.
So the U-shaped bucks, which are repeated, normally persist. They don't go away with exercise. And they are almost always associated with underlying pain.
Yeah,
The U-shaped bucks can be associated with pain, but not necessarily so.
that's really interesting. Along the same lines, we had a specific question that involved tripping and horses that trip. And I wanted to get your take on that as well.
Well, I would want to know if the horse was tripping behind or in front or both. And generally speaking, let's say the horse is tripping behind. This could be because the toes are too long of the feet. It could be that the horse is not strong enough. It could be a reflection of hind limb lameness. We have to bear in mind that if you have chronic pain, the neuromuscular pathways change. So if you think about older people with chronic pain develop a propensity to fall over and then they fracture their hip.
Mm-hmm.
And they do that because they have altered neuromuscular pathways. So they're placing their feet to the ground differently. And I believe we see the same thing in horses with chronic hind limb pain. They start to place their hind limbs to the ground differently. So they trip behind, or the rider says the horse keeps giving way behind. And they're giving way behind because they're not landing on the foot normally. They're not properly extending the fetlock. The fetlock isn't dropping as much as it should do. So the limb is less stable. So it effectively gives way. And if you can take away the underlying discomfort and restore more normal neuromuscular pathways, that propensity to trip will go away. If they're tripping in front, the same mechanisms can apply, but it also gets a bit more complex because you could have neck-related problems which can induce tripping. And both tripping in front and behind, you always have to say, is the horse overall neurologically normal, or does it have some degree of incoordination and or weakness which makes it more likely to trip?
That makes sense. So to wrap up, I think you've emphasized quite a bit the importance of evaluating horses under saddle in all three gaits. But not only do we not see that happen a lot, but we particularly don't see that happen in the canter. What should an evaluation of the canter under saddle look like to you? What do people do? What do people look for?
Well, I want to see the horse in canter on both reins, both going around the periphery of the arena and at least in 20-meter diameter circles, and perhaps in smaller diameter circles as well, because that becomes more difficult for the horse. And I want to see also the horse do quite a number of transitions from trot to canter and canter to trot, because that tells me that's more difficult for the horse to do repeated transitions. And that can tell me quite a lot about how it is engaging its hind limbs. Because some horses with hind limb problems in the downward transition from canter to trot will not flex the lumbosacral joint properly. They will not bring the hind limbs underneath the trunk properly. They will leave their hind limbs trailing, and they may take irregular length steps behind. So that can be very revealing about letting us know that there is indeed a hind limb problem. So to be performing those transitions, I think, is of crucial importance. I sometimes ask the rider to sit in a 2-point position versus a 3-point position to see how the horse's gait changes. I'm always wanting to see the horse from all directions. So I see the horse from behind, from the side, and from the front. Then I get the maximum information about how the horse is moving and what it's doing to the saddle and what it's doing to the rider as well. And I always ask the rider, well, what do you feel? I think that's important to get feedback from the rider.
Yeah, absolutely. I mean, you talked about getting on clients' horses. I wish all vets could do that, because sometimes as a rider, it's hard to communicate what you're feeling, but that really is the biggest indication that there's a problem, is what you're feeling underneath you. If something feels wrong, then it probably is.
Yes, always follow your gut feel with respect to that sort of thing.
That's great advice.
Even if the vet tells you they can't see anything, if you can feel something, it generally means something is wrong.
Yeah, that goes for trainers too. Even if your trainer tells you nothing's wrong, I find people know their horses better than anybody else does, and so I always try to put a lot of weight in what people say about the horse that they are the ones that regularly ride, because they're going to know the most. They're going to have the most information that's valuable.
Absolutely, yes.
I think that's everything that.
Well, there was one other question that I think came up during the live Q&A that I think it was phrased fairly broadly. And as I looked at it, I thought, wow, this could be a great topic for a future discussion, or maybe a blog topic. But I thought maybe directing it specifically in terms of the canter. The question was, a few times during the discussion, you had referred to when the horse is trained appropriately or using appropriate training, and looking for some definition around appropriate training. So when it comes to canter, you talked about, not having so much emphasis, really paying attention to that head position and the fallout that can come from that. But do you have some points that you would like to make about what appropriate training for canter should look like?
Well, to me, it involves cross training. So we're not just going round and round in circles. We're using poles on the ground to canter over poles on the ground. We're adjusting the step length and the speed. So going faster and bigger steps and then slower. So we're constantly adjusting the canter. We're doing some of this outside. So we're not just doing it within the confines of an arena. We're doing it outside. We're not just doing it on a horizontal surface. We're doing it going up an incline as well. And all of those things, I think, are promoting riding the horse forwards and allowing the horse to go forwards, and progressive development of musculoskeletal strength and coordination by using a variety of different techniques.
I would just add to that. I feel like this has come up in other lives that we've done as well, that I would just add that it's important to listen to your horse, because the behavior won't lie. If the canter is getting better, then you're probably doing a good job of training. And if you're not making any progress, then you need to look at what other types of things you can do and what you can adjust to make it more comfortable for them.
Yeah, absolutely. Absolutely. And if you know that you've got problems, so for example, you've got a 3-day event horse, which has problems with the flying changes, don't do flying changes during the warm-up for your dressage test. This is just going to stress the horse mentally and physically. Take your chance when you're in the arena, but don't practice them before you go in. I watch this time and time again. It goes downhill progressively.
Yeah.
So think about how to manage your horse to present it optimally.
That's a great overall point. It might be a little bit off topic, but I used to have a horse that got very stressed in the warm up just in general. And we were competing at Grand Prix, and I would skip the original warm up and go straight to the on deck warm up and just warm up for 10 minutes before I went in the show ring. And people thought I was crazy, because you see people trying to actually teach their horses things in the warm up, and and trying to fix problems in the warm up, and it's not the time. That's the time to stress the horse out. You're better off just getting things loose and going for it. And that it always worked for me, and different horses need different preparation. But I would add to that also, you were saying if you have a horse with a known problem. I have a student right now who has a young horse, a 5-year-old, who has a known OCD lesion in his neck and does struggle with the canter, and she's doing a fantastic job of bringing him along. She does a lot of cross training. She never rides him in the indoor school because the turns are too tight. She does, polls, and we're actually doing a lot of positive reinforcement where she will, start at one spot and come to me, where I will use food to reinforce him if he goes forward to get to me, and making it fun for him, especially at his age. He's still very, very young, and he does have this history of experiencing pain. And it's fun to see someone who is really thinking outside the box and not just trying to make this horse fit their training protocol, but actually taking steps to make it worthwhile for him, and get a good outcome in the long run, not thinking about what she gets day to day, but what she's going to get over time. And I think in general, that's just a really good approach to training, to listen to the horse and not have your goals determine your own personal goals determine what you feel needs to happen in each particular training session, but really keep an open mind and try doing things a little bit differently with horses like that, because there are horses that have these underlying pain issues that with proper training and muscle development can improve, particularly if they're properly diagnosed in the first place.
Yeah.
Excellent. Well,
Yeah.
what great discussion. There's been a lot of comments, a lot of engagement, and we're excited to have you here with us always. And there's been a lot of excitement around this discussion. So thank you so much, Dr. Sue. A couple of things before we wrap up. We are going to continue doing these lives every other Thursday, and we welcome you to submit any ideas that you have for topics you'd like us to discuss. You can go ahead and message us on our Facebook through our social media, or you can do a contact form on our websites. You can look for us at 24horsebehaviors.org or trainwithtrustproject.org to reach out to us and find some of our educational materials that we have available. In 2 weeks, so on August 24th, we're going to be looking at some critical issues involving an evidence-based understanding of equine welfare and the future of horse sports, and a topic that is pretty hot button right now, our social license to ride. So taking a look at this discussion from the perspective of how we can use our evidence-based understanding of equine welfare in this conversation about social license to ride. So that's what we'll be discussing 2 weeks from now on August 24th. So we'll be sharing with you opportunities, of course, to ask us questions, and you can submit those ahead of time. We also have our translations in the works. We wanted to say a thank you to some people who volunteered after our last live event. So we've got even more translations of the free mobile field guide of the 24 behaviors. Those are in progress, so we'll let you know when those come out. We are also finishing up some worksheets that should be very helpful, that Dr. Dyson has developed, wanted us to sort of pull together, and we've worked with to make the information very useful, hopefully for you all boots on the ground. One about how to find a vet who will be a good fit for assessing some of these orthopedic issues. And there's also a list of what we're calling additional behaviors that are things that you can look for, similar to some of the things that Dr. Dyson was talking about today, issues at Canter that could reveal an underlying musculoskeletal problem. So there's a list of additional behaviors that you all can look for. So we're coming out with that worksheet as well. And then Dr. Dyson, your book will be coming out. Did you want to quickly preview what you know about your book coming out shortly?
Yes, Sue Palmer and I have written a book called Harmonious Horsemanship, using the ridden horse ethogram to optimize potential, partnership, and performance. And this should be out by the end of September. It goes to the printers next week. So we're really excited. So it'll be available in just a few weeks. It can be pre-ordered, or you can leave it till it's actually out.
That is great.
Get excited to read it.
All right. Well, thank you everyone for joining us today. We'll go ahead and sign off, and we'll look forward to seeing you and many others in a couple of weeks.